Hey beauties, welcome back to my channel. And if you're new here, welcome and thank you for being here. My name is Larice. I am your host and I am the founding owner of beyondbody.com. But if you'd like to learn more about me, you can do so at iamlarice.com. So now that we got that intro out of the way, I am super excited to introduce to you guys this next, I guess you can call it episodes, these next few um series, these next few videos. So as you know, if you've been following along, I've took you through my weight loss journey, my weight gain journey, and previously you just watched a live surgical procedure. So now I am going to introduce to you guys these mini series that I created based upon my surgical procedure, and I've titled it Let's Ask a Surgeon. So, in these little episodes of Let's Ask a Surgeon, I will be interviewing my surgeon, Dr. Laverson, and we're discussing specific topics. So, each series is different topics based upon my specific surgery, and I might even dive into other surgical procedures that I haven't personally gotten done, but maybe other women have gotten done or other women are interested in getting done. So since I already have access to him, why not utilize him and the knowledge that he has and share it with you all? So stay tuned as I connect you to the first episode of Let's Ask a Surgeon. So, in today's episode of Let's Ask a Surgeon with Dr. Steve Laverson, we are going to be talking about tummy tucks, lipo, and muscle repair. So, give me a moment while I bring the man of the hour out.
Hi, Larice, thank you.
Hey, what's up, Dr. Laverson?
What
I'm
was the
so
other
excited.
website? IamLarice.com.
Yes, yes. So that's easier. Like they can still get to Beyond Body. They can find me on Facebook, YouTube, Instagram, learn more things about me. So that's just the easier way to connect and stay connected.
Okay.
Yes. All right. So we are here. I feel like I haven't seen you in forever, man. Like all of my post-op appointments, like they just gotten scarce and scarce. Like
I
I got
know.
a reason
We
to come
we do
back.
miss you, Larice, but the main thing is we also miss your sons, okay? Because they were always entertaining and
Yes,
fun. So
man.
there's always something new going on with those guys.
Yes, all the time. Look, I told him I'm about to record with Dr. Laverson. Stay out.
You think she's got a lot of energy? You should see the two boys.
Oh my gosh, you guys, you don't
All
want to
right.
see them. All right, so let's start off with the first question. The first question is I didn't even test this out, Dr. Laverson, to see how the questions are going to go with my new little. You see all this razzle dazzle I got going on here?
Yes, I like it.
Let's see. I don't know if this is going to work. Nope. All right, let me take there it is. Okay. So, what is a tummy tuck? That is question number one.
Okay, so tummy tuck is sort of the common name for a plastic surgery operation that we call abdominoplasty. Okay, abdominoplasty mean plastic comes from the Greek word to mold or to form. So so um, so abdominoplasty is to mold or form the abdomen. It's the abdominal wall, the front of the abdomen, which is the area that stretches out. during pregnancy, during, after childbirth. Sometimes it shrinks back down and sometimes it doesn't. Um, it's, it's a problem for a lot of women because they want the hourglass shape. They want it flat. They want it narrow, the waist. And so the tummy tuck is they call it a tuck. You don't really tuck in the skin. You're removing that excess loose skin and tightening. And it is sort of a tuck, the abdominal wall. There are many variations of the procedure, but that's what the tummy tuck is. It's to tighten, restore sort of a fit, youthful, tight abdominal wall, and get rid of the loose skin.
Okay. All right. So the next question is, what is a muscle repair?
Okay, so the muscle repair is the term that's for that rectus abdominis muscle. Okay, so when during the pregnancy, of course, the belly stretches out, and there's really two layers to the abdominal wall. There's the outside layer, which is skin and fat. Okay, the skin and fat, but underneath that, there's muscle and connective tissue. The muscle, that rectus abdominis, is the washboard muscle that you see if you're super lean and fit, you'll see the washboard, the tendinous inscriptions, what we call between that rectus muscle, which goes from the sternum up above down to the pubic symphysis below. It's a vertically oriented, paired muscle on either side of the midline. And that muscle, when the belly stretches during pregnancy, especially multiple pregnancies, or just in some women, the two paired muscles, one on the right side, one on the left side, that are very close to the midline, just on either side of the belly button, from top to bottom of the belly, they will separate. Okay, they separate from one another, and there's like this gap in the middle where there's no muscle. And sometimes that doesn't come back after the pregnancy. They don't come back together. So it's called what we call a diastasis. Diastasis is apart. They've come apart. Again, that's from probably the Greek or Latin root, diastasis. So they come apart, and part of the tummy tuck is we want to tighten that abdominal wall and bring those muscles back together so the woman can do abs, so she feels like she's got support. Sometimes it comes apart in the abdominal wall so weak that women have back pain, they have postural problems, even incontinence, all these other things that can happen after pregnancy. So the muscle repair is we bring the muscle back together, but we do it, muscle does not hold sutures well, but the connective tissue envelope around those muscles holds sutures very well. So we just tighten that connective tissue envelope and it brings the muscles back together in the midline.
Okay, so then let me get to the next question that goes hand in hand. So you were mentioning about having kids, but if a woman's never had children before, would she need muscle repair? Like, is muscle repair only for women that have given birth, or would there be another reason why you might need to have it?
Okay, that's an excellent question, because the answer is no. It's not just for women who've had children. There are some folks, and I just had one yesterday in my office. I did a tummy tuck on this woman. She had two children, but she's in her 70s, and she said, no, even after my second child, they didn't come apart. It happened with age. She attributed it to age, and aging can weaken the abdominal wall. It's honestly, so many things in the body are hormone responsive. I've seen people with just congenital weakness of the abdominal wall, separated muscle, hernias, things like that, just from activity over years. Sometimes fitness. I've seen people that are very fit and that are always doing core exercises. The muscles can separate in the midline from repeated certain types of exercise, and so the answer is no. It's not just postpartum, not just after pregnancy. It could be a combination of your activity, your genetic strength of the abdominal wall, where the muscles are, so many little variables, aging, all these things can contribute. And then there are some people who have just weak connective tissue. These are people that get hernias, in the normal activities of daily living over years, oh, they've got a hernia, needs to be fixed. It's just their weak connective tissue in certain areas. So the answer is no, it's not always postpartum.
Okay. The next question, is a muscle repair required or a necessity when getting a tummy tuck? Like, can you get a tummy tuck without getting muscle repair?
The answer is no. It's not a necessity, Laurice. I try to individualize 90, I would say 95 or greater, 95%. Almost always I'll do the muscle repair because I do want to flatten the belly. I do want to tighten it. I want to narrow the waist. But some women, Laurice, are very fit. They don't have a diastasis. And their main motivation, their primary motivation for the procedure is loose skin. And if I do a muscle repair and narrow the waist, Laurice, it actually can worsen the loose skin problem because when you tighten and diminish the size of the abdominal wall, the woman's already come in with loose skin. You're making more loose skin because you're tightening the abdominal wall underneath that, and it makes more loose skin. You don't really want to do that if she's fit, if she's, if she's in great shape and she just wants the loose skin removed. No, there's no reason to tighten the muscle, and it prolongs the recovery because tightening that abdominal wall, the connective tissue, is the main source of pain after tummy tuck.
Yeah, I'll agree.
Yeah.
I'll agree. All right. So then the next question is, how long does the numbness last? And is the numbness due to the tummy tuck or the muscle repair?
Okay. Well, numbness is diminished sensation of the skin of the abdominal wall. And this tummy tuck operation involves lifting the skin and the fat, which is the outer stretch layer, lifting that skin and fat off the underlying deep layer of muscle and connective tissue. Okay, so in that separation, Laurice, there are some sensory nerves that pass through the connective tissue to the skin, which are divided. Okay, those nerves are divided, and that results in numbness. Okay, the numbness, diminished sensation can be permanent. Okay, it's usually, I would say, permanent. When those nerves are divided, that sensation never comes back. But over time, the nerves that remain, they tend to, there are two things that happen. Patients get used to the numbness in that area a little bit, and the other nerves seem to take up for it a little bit, meaning they become hypersensitive. And so even though the numbness may bother patients right after the surgery, it tends to diminish. I have rarely, I can't even remember a single patient complaining about permanent numbness of their abdomen, even though I know it's there. Okay. So I think there are two things that happen. They get used to it, number one, and number two, the surrounding nerves tend to become more hypersensitive. So it doesn't bother them so much after a while.
Yeah, I'll agree to that. What am I like almost 8 months post-op? Like the numbness is getting better. I don't know if that makes sense. Like at first it was super numb and like it was just weird. Now I feel like I can feel it a little, my stomach a little better, and the numbness is like less, but it's still there.
Yeah.
If that makes sense.
Yeah, it
Yeah.
does make sense. It's pretty typical, I think, your
Yeah.
experience there.
It doesn't bother me as much anymore. All right. So then the next question is, what is liposuction?
Okay, so liposuction is removal of fat only. Okay, it doesn't affect connective tissue, it doesn't affect skin, it doesn't affect muscle or anything else. It's removal of fat and sculpting the body. We can really shape the body by removing disproportionate bulges. And these days, liposuction, okay, I've been doing this a long time, 30 years, over 30 years, but liposuction has evolved to so many little subdivisions for sculpting, like superficial liposuction, which is also called liposculpture. And then there's not only fat removal, but fat transfer to areas where maybe the patient wants a little more bulk, a little more volume. So you can really do a lot more with liposuction and fat transfer than liposuction alone. But if somebody doesn't like, they feel like they have too much fat in one area, they want a more narrow waist. If it's fat, Okay, we can't change the skeleton really, the ribs or the, well,
Mhm.
actually you can. Okay, we can talk about that later a little bit, but basically, if a bulge or a fullness in one area is from fat, liposuction allows us to remove that fat and thin and trim that area.
Okay. Um, does every tummy tuck patient need to have liposuction?
Absolutely not. There's a doctor in South America that pioneered lipo-abdominoplasty, and a lot of surgeons do incorporate lipo with every tummy tuck. But we in San Diego get a lot of women that are fit and lean, and they're thin, and they really maybe just have a stretched abdominal wall and loose skin after pregnancy. And these women don't need liposuction because you want the belly to look proportionate and like it matches the rest of the body. Um, so if the woman has very low body fat, very lean physique, um, no, they don't need liposuction. And when I do the tummy tuck, I do what's called direct excision of fat. I'm looking at the fat. I remove the fat to sculpt certain features into the abdominal wall. So it's not liposuction, but it's still removal of fat. I just do it. It's called surgical lipectomy. I do it open. I see the
Mhm.
fat. I remove it, and it's much more selective than lipo. So the answer is no. Every patient doesn't need. On the other hand, liposuction added to tummy tuck, depending on the situation, if the person has full flanks, big bulges there, sometimes they want the waist or the flanks thinned out at the same time. So it's
Mhm.
never, every patient doesn't need it, but it can enhance the result in many situations.
I agree with that. And I didn't know that yours is like your technique is different. Yours sound like less painful, less bruising because I've
Mhm.
seen patients with liposuction and like they just look like they've been in a boxing ring. Like it looks like it hurts bad.
Yeah.
Yeah, so yours sound very calming and nicer
Yeah.
to deal with. All right, so the next question is, can a patient get lipo without getting a tummy tuck? And can a patient have muscle repair without a tummy tuck? Like, do you, I guess like it doesn't have to be a trifecta type thing. Like, can somebody come in and just say, hey, I want a muscle repair, but I don't need extra skin removed, and vice versa?
Yeah, the answer is yes. You know, I'm actually writing a paper now for my journal, the Aesthetic Surgery Journal, on it's and the title of the paper is it's about tummy tuck abdominoplasty, and the title is inconsistent technique for consistent results. Okay,
Mm,
inconsistent technique meaning or an inconsistent approach for consistent results. And what do I mean by inconsistent? Well, every patient's different, Maurice, as you know. We live in a world of human variability, which is the beauty of humanity. And can a patient get lipo without? Yes, if they need just fat removed, yes, absolutely. And some patients just don't want it. The tummy tuck involves a scar, as you know. It involves more downtime. Lipo in general is less recovery, maybe less invasive, and this is preferable for many patients. On the other hand, if somebody comes in and they have loose hanging skin, I'm definitely not going to encourage them to get lipo without a tummy tuck. They're not only will they not be happy, but it will make the problem worse. So
mm,
so it's in surgery we call that patient selection, meaning you have to select the right procedure for the right patient. And there's such a wide variation of presentations and bodies out there that the answer is yes. Some patients just need lipo, not a tummy tuck. And can a patient have a muscle repair without a tummy tuck? Yes. If they have a bulge, just a bulging abdomen, and they don't really have extra loose hanging skin, and that bulge, they just want that fixed and flattened and tightened, then the answer is absolutely yes. But I do have to say this, Laurice, usually when I do that, it's what I call a type 1 tummy tuck.
mm-hmm,
I'll take a little skin off the bottom because just tightening the abdominal wall bulge, that muscle repair,
mm-hmm.
um, results in extra skin.
Right.
even if they come in and they've got a bulge, that bulge is pushing out the skin. When I flatten the bulge and really tighten and do that muscle repair, of course, I'm going to do the best I can to flatten the belly, to narrow the waist, to make an hourglass, really tighten it up. And the overlying skin becomes a little loose. So I pull it down and I'll remove the excess. It's a shorter scar.
Right.
Okay. It's a short, low scar, but usually, your question is, can a patient have a muscle? Yes. But usually I'm going to want to take some skin also. It just doesn't have to be as much as a regular tummy tuck.
Okay. And then the last and final question came from one of my ladies in my private Facebook group. She said, "What would you recommend for a tummy tuck incision that has a shelf?"
Okay, so when if that patient's asking about a shelf, what they're usually referring to, I think, is at the incision, like above the scar, it's like projecting out, and below the scar, it's flat. So she feels like she's got a shelf hanging over. Okay, it could be the other way around, that the belly's flat and maybe the mons pubis, that area below the skin, below the scar, is sticking out. I've heard one patient call it a fupa. I don't know what exactly that stands for. I forget. But but anyway, what is that fupa? You know what it is?
I heard it's called fat upper
Fat upper pubic
something
area.
area.
Yeah.
Yeah, yeah.
Okay. Whatever. So the shelf is a differential of the projection above the scar and below the scar. Okay. And so where that abdominal skin was pulled down, it's either there's more fat there above the scar than there is in the mons below the scar, or there's more fat in the mons, so the shelf is the other way around. So what would I recommend to smooth it out? There are different techniques. You can, if the skin's really tight, you could just lipo the area that's sticking out. If the shelf is from a loose abdominal wall that's bulging out, I would probably bring the patient back to surgery and tighten that abdominal wall. You have the important thing in medicine, Laurice, as you know, is in general, treatment follows diagnosis. Okay, so the first thing the doctor has to do is make a diagnosis. What is that shelf? Is that shelf fat? Is it like loose extra skin hanging over? Is it an abdominal wall bulge? What's causing the shelf? That's what has to be fixed to fix the shelf. So it takes physical examination, an understanding of maybe how the surgery was done. But I do encourage wherever that question came from, that person might want to think about going back to the doctor that did the tummy tuck and say, look, I'm not happy about this shelf. I mean, and see if the doctor can fix it. I try to fix things without charging patients, because even, Laurice, I've been a surgeon 30 years, and I can never tell in advance exactly how it's going to turn out. And I
Right.
can never tell exactly how the patient's going to feel about it. Sometimes there's something that I think, oh, it's not so bad, but it's bothering a patient. Well, I'm going to want to fix it because you want that patient happy.
Right.
Sometimes there's something that bothers me, but it doesn't bother the patient. I mean, I'm not
Mhm.
going to force them to have something fixed or have more surgery if it doesn't bother them. But
Right.
on the other hand, if there's something, usually it bothers us both. Okay, I can see it. It detracts from the result, and I don't want them going through the rest of their life not happy with something about a surgery that they had. So I would say maybe go back to that surgeon, show that doctor the shelf that they're not, or if it's a long way, just take a picture of it or a little video and email it to the doctor's staff, and say, look, can this be fixed, and see what they say. But the answer is yes, it can be fixed. Okay, but it depends on what's exactly causing the shelf, what it looks like, how long it is, how much projection there is. But I understand people don't want that shelf showing in a swimsuit or in their clothing, whatever. No, it should be smooth. If it's bothering a patient enough to ask the question, then I would say try to improve that situation.
Okay. Well, that was the last and final question. And, I know you're busy. You jumped in between, appointments. I'm super thankful and grateful for that. It's always a pleasure to have you on, Dr. Laverson.
Laurice, thank you so much. And I do want to throw in a word for Beyond Body, great skincare, great moisturizer. on the go. Carry it in your purse. It's very, very, very nice. A lot of good products there.
Thank you. I appreciate that. Look, that's
Yeah,
why I say you come on here looking all young and smooth and stuff.
yeah. Get your glow and yeah.
Yes. All right, Dr. Laverson, thank you for joining us. And, I look forward to another episode. I got to figure out what we're going to talk about next.
All right. Likewise, Larice. Thank you so much.
All right, sir. Have a good day.
All right.
Bye. Boom. All right, so there you have it. Tummy tucks, lipo, and muscle repair with Dr. Steve Laverson at Feel Beautiful Plastic Surgery in San Diego. So if this is something you guys look forward to, if you like content like this, if you are also on a fitness journey like myself, make sure you subscribe to this channel. Hit the like, also turn on your bell notification so every time I do upload a new video, you will be notified. And if you have any friends, family members, coworkers, or whatever that you know that might be interested in this channel, send them my way, you guys. See you on the next one. Bye.